once you get over the music and all that, really interesting what she's saying, isn't it? What do you think? Well, Thorrun Govind is a community pharmacist. Thorrun, thanks so much for talking to us this afternoon.
No problem. Yes, I'm working today in a very busy community pharmacy.
Oh, well, look, I'm only going to take up a little bit of your time. Is that all right?
No problem. I think it's a really important discussion to have, and I think it highlights maybe the perception of pharmacists that the public have. We're highly skilled professionals trained for 4 years at university, and then we have a year's training. And these EHC, as we call them, emergency hormonal contraceptions, I think are really important because sometimes people aren't aware of the availability of contraception, and also they aren't aware of the options available to them. So in some of the consultations that I've had with patients, we've discussed what future contraception they could have, and they've also decided what contraception they're going to go and speak to the doctor about, which is saving valuable GP time as well. I've also seen a number of patients who, for example, have repeatedly come in for the morning after pill, and that's been a flag for me. And some of my colleagues have also picked up on patients who perhaps have been abused or in abusive relationships, and that can be a really difficult conversation to have with someone. But I think it's really vital because some of the most vulnerable people in our communities come into community pharmacies every day, and they need to know that there's someone there to support them.
Have you heard anybody say, look, just give me the pill, I know what I did, the condom broke, I just want it and I need to get out. I don't want to hear any of your stupid questions. I'm okay, it was me and my boyfriend, condom burst, can I just have it please quickly because I want to get out of it?
I think we hear that conversation regarding the sale of medicines generally, and people can often not realise the interactions between medications. For example, with the morning after pill, I hate calling it that because I think it's not just the morning after. It's available for some of them. It's a 72-hour gap that you have. For some people, it's 5 days. And we always have that conversation about, is it appropriate for that patient? And some of them.
Yeah, but the point I'm trying to make is, are you ever confronted by somebody who is not interested in having the conversation?
I haven't had that conversation with regards to the morning after pill.
Really?
I think people see that that they need to take it, and they're really worried about taking it, and some of them even need to come back for a second dose of it. If you have vomiting, for example, in the first 2 hours, you need to present again to have a second dose. So they realise how important it is, and also how sensitively pharmacists deal with it.
But that isn't the experience we just heard there, is it? That lady was saying, look, that I don't want to go in and speak to somebody better and know what happened, and I feel a little bit embarrassed, and I feel sometimes a bit patronised.
Okay, but would a doctor do the same? Would a doctor just send out a prescription for that without consultation? I don't think so. You would have to have a conversation with your doctor for them to prescribe anything. And as something which is a pharmacy-only medicine, the morning after pill, it's something that obviously pharmacists are therefore giving to that individual patient.
No, I accept that, but in France they don't. That's what she said. In France they don't.
That's a different issue. In France, I don't know about the availability and how whether it's free in France or not, but obviously in certain areas of the UK, pharmacists are trained, and we are able to give out under what's called a patient group directive, which means that we don't have to have a legally valid prescription for it. So we're giving it out to that patient, and then we have criteria we can give it out for free of charge for. So that's something to highlight.
In terms of how you ask the questions, were you coach? I appreciate your qualifications. Certainly, I use my pharmacist like the GP.
Yeah.
I've got this. What do you think I could? So I understand that. But did they talk to you about tone?
Yes, absolutely. At university, we have a number of discussions and what we call OSCE, so they're sort of experience-based consultations, and there's consultation skills training that we do. I'm going to be doing flu vaccinations for the public now, so we have flu training again.
No. Me coming in there for an injection against the flu is very different to a young lady coming in there for the morning after pill, I would suggest.
Yes, but as a community pharmacist, I see a variety of patients from a variety of backgrounds, and obviously that means that I have to be able to cater for a number of for different people with the tone and also with confidentiality. Methadone patients who maybe misuse drugs is the same conversation. To take them into a private consultation room where they can tell me whatever they need to tell me, and it's all confidential.
What about the idea, this is the Faculty of Sexual and Reproductive Health. These are big bods. They set the standards for sexual health care. So they're standard setters, and they say the compulsory consultation is not medically necessary.
Well, it's like I bring it back to that same point again. Would a GP, would a doctor, would a consultant give out a medication without seeing the patient or having a discussion with them? And I think the answer is no.